Jessica. I'm going to be the nurse practitioner doing your head to toe assessment.
Okay.
So overall, our head is normocephalic. I'm going to feel around for any indentations. I don't see any infestations. Hair distribution is even, smooth texture. I'm going to go ahead and palpate our temporal arteries, and they're +2. We're going to move down to our temporal mandibular joint. Can you just clench your jaw for me? And that's testing our masseter muscle, cranial nerve 5. Motor portion is intact. And can you open and close it? Okay, we don't have any subluxation or crepitus there either. I'm gonna go ahead and feel our lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and I don't feel any enlarged nodes or tenderness there. Go ahead and pull your mask down for me. Close your eyes and tell me where you feel this.
Ooh, left cheek, right cheek, forehead, chin.
Okay, cranial nerve 5, our sensory portion is intact. Smile for me, frown, puff out your cheeks, pucker your lips, and raise your eyebrows. So that's cranial nerve 7, our facial is intact. We're gonna go ahead and move on to your ears first. Looking at the outside of our ears, tragus and pinna, there's no masses we can see, no lesions, no tenderness. I'm just gonna go ahead and look in your ears. External auditory canal is free of erythema or cerumen. Tympanic membrane is pearly gray.
Ears up in there.
Sorry.
You're good. You got a good look.
Tragus and pinna, no tenderness, no redness, no masses. And let's see in here. Tympanic membrane's pearly gray. I see you're kind of like at 5 o'clock. Go ahead and occlude one nostril for me and sniff, and the other. We have patency of our nose. Nose is midline. Go ahead and palpate our maxillary sinus. Tell me if you have any tenderness. Frontal sinus, no tenderness. Go ahead and open your mouth for me. Say ah.
Ah.
Okay, oral mucosa is pink and moist. Dentition is in good repair, no dental caries. Tongue is midline, no fasciculations. Can you lift it up? Okay, and the floor of our tongue, the base of our mouth is without any masses or lesions. Uvula and soft palate rise. So our cranial nerves 9 and 10 are intact. We're going to go ahead and do our eye exam now, okay? So I want you to cover your left eye and read this line for me if you can.
Okay, EPTZO.
And close the other eye, and then read it backwards.
OZTPE.
Okay, that's 20/20 vision. That's great. I'm looking at our eyes. Sclera are clear, no icterus. Conjunctiva are pink and moist, no exudates. Our palpebral fissures are symmetrical. Hair distribution of our eyebrows and eyelashes is good. I'm going to check for our red reflex. So just look straight ahead for me. And we got a red reflex. And the other side. Okay, and I see our cone of light. They're looking good. Okay, so I want you to look at the door and then look at my pen. Okay, and we have accommodation. Keep your eyes on my pen and convergence. And we're going to test our extraocular eye movement. So follow with your eyes. Up and down and across. No nystagmus. Extraocular movements are in tandem. So we're looking good there. Okay, now we're going to move to your throat. Trachea is midline. Swallow for me. Okay, no goiter. Our thyroid is slightly palpable. No masses. Skin of our neck looks normal. No nevi. Can you shrug your shoulders? Okay, cranial nerve 11. Accessory is intact. So I'm going to go ahead and test our strength here of our shoulders. So push forward against me and pull back against me. Okay, that's 5 of 5 on our shoulder strength. Our joints look good. No masses, no tenderness. They are symmetrical there too. I'm going to listen for carotid bruit and check our carotid pulses. +2. +2. With our bell. No bruit. And no bruit. Okay, I'm gonna have you turn around and we're going to look at the skin of your back. Just a little bit more. That's good. Looking at the skin, no cyanosis, no tripod positioning, no signs of respiratory distress. Just take a deep breath for me. Okay, no excursion. Our chest rise is symmetrical. So I'm going to have you say 99.
99. 99. 99.
Tactile fremitus is equal, and I'm going to do some percussion. And resonance is heard throughout the lung fields. We're going to listen. Just take a breath each time you hear me move this. And we're listening into the lung bases. Okay, now I want you to say, whisper 99. And say E. Okay. So no bronchophony, egophony, or whisper pectoriliqui. If you'll turn back around for me. I'm going to observe the skin of our anterior chest. It is smooth, warm, dry, no sweating, no cyanosis, no retractions. Just take a breath for me. Chest expansion is symmetrical and say 99.
99. 99.
And tactile fremitus is symmetrical as well. We're going to listen to our lung fields now. Okay. I'm going to listen to your heart sounds. Aortic, pulmonic, Erb's point, tricuspid, mitral, and with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. I'm going to palpate our PMI. And I'm going to auscultate it for a full minute. And we've got S1 and S2. Okay, I'm going to have you lay back now. Before you do, let's pop up to 45 degrees and turn your head. No jugular vein distension. Okay. In the lying position, we're going to listen, auscultate our heart sounds, both with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral, and the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. I am observing for any heaves, lifts, or thrills while I'm doing my assessment as well, and we don't have any of those, so that is good. Our skin on our chest and abdomen. Looks good. No lesions or nevi, no scars, anything like that. I'm going to auscultate our abdominal aorta. No bruit. Actually, I'm going to use the bell. No bruit. Renal arteries. Iliac. And femoral. Okay, no bruits. I'm going to listen to your abdomen. Can you lift your shirt up just a little
There we
bit?
go.
Okay. All four quadrants. And our vowel sounds are normoactive. We're going to do some percussion. Timpani, 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 timpani. Then we're going to do some light palpation. Tell me if you have any soreness or tenderness when I palpate. I don't feel any masses, hernias, anything like that. I don't see any grimacing. We're going to feel for our liver over here. Okay, no hepatomegaly there. And we're going to try to feel for our spleen. And that is not palpable. So, sorry. English. Okay, so we are good there. Go ahead and sit back up for me. Tell me if you have any tenderness. We're testing for CBA tenderness. No tenderness?
Oh, good.
Okay, great. We're going to look at our upper extremities. Looking at our skin, it's warm, dry, intact, no tenting. Our capillary refill is less than 3 seconds. Our radial pulses are bounding. We're going to look at our finger joints first. No swelling, no crepitus, no nodules, no redness. We're going to test our finger range of motion, so squeeze. Okay, and spread them out. And adduct and thumb opposition. Okay, we're looking at our wrist joints. No deformities, they're symmetrical, no masses, no swelling. Bend, flex, extend, hyperextend, ulnar deviate, radial deviate, and rotate. Okay, good range of motion there. Looking at our elbow joints, no nodules, no masses, no crepitus. Looking good there. Bend for me. Bend it for me. Yeah, pull against me and push against me. Okay, our strength is 5 of 5 there. We already did our shoulders. We're going to test your sensation of your skin. So close your eyes for me and point to where you feel this.
Not dark.
Okay.
Right on.
Okay, we got good sensation there. We are going to check for our vibratory sense, and we're also going to check your hearing.
Sounds good.
Same time. Okay, we're going to test for lateralization. Tell me if you hear it more so on one side than the other. Okay, we're going to put this on the mastoid bone, and tell me when you no longer feel the vibration.
Can't feel it.
Do you hear it?
Yes.
Okay. And on this side?
I
You
hear
still
it.
here? Okay, so air conduction is greater than bone conduction, which we would expect. Tell me if you feel this vibration.
Yes.
Okay.
Yes.
The vibration.
Sorry.
Okay, we'll go ahead and do this on our ankles as well.
Okay. Feel
And do you feel this one?
Mhm.
Okay, good. So we've got sensation there. I want you to close your eyes. I'm gonna draw a letter or number in your hand, and you tell me what it is.
it. 14?
Oh no. Sorry, sir, you're
Give
very
me-
ill.
Give me an easy one.
Okay.
0 or O.
Okay. So our stereognosis is a little off. Close your eyes. We're going to try something else. Tell me what this item is.
Coin.
Okay, and tell me what this item is.
A tongue compressor.
Okay, graphesthesia is intact. Now we are going to test your reflexes. Okay. Brachioradialis, bicep, tricep, patellar, Achilles, and Babinski. the other side. Brachioradialis. Bicep. Tricep. Patella. Achilles. And Babinski. Okay, those are all intact. We're going to test cerebellar function with some rapid alternating movement. So pat your legs front and back like this and get faster and faster. Okay, good.
All I got.
Touch your finger to your nose and then touch my finger. And back to nose and back to nose and back to nose. Okay, good. Now hold up your hands and touch each finger to your thumb and back. Okay, we have good cerebellar function. Now we're going to look at our skin of our lower extremities. Skin is smooth, warm, dry, no edema, no swelling. We're going to test our pulses. Our anterior tibial are good. Dorsalis pedis pulses are good, +2. Looking at no pitting edema, no lesions or anything on the feet. So let me have you flex your toes, okay, and try to hyperextend them, good. And rotate your feet in and out, and circle them around, okay. Press down against me, and pull your feet up against me, okay. Our foot strength is 5 of 5. Looking at our knee joints, they look good. No swelling, no nodules, they're symmetrical. Press against me. Okay, we're testing our knee strength, pull against me, if that's 5 of 5. And we're gonna test our hip strength while we're here. Try to lift your legs up, okay? And hip strength is good, 5 of 5. So now I'm gonna test the sensation of your lower extremity. So close your eyes and point to where you feel this.
There.
Okay.
So.
Okay. We do have good sensation in our lower extremities as well. All right, so stand up for me. We're going to assess the hip joints. No redness, no nodules, no deformities, no swelling. Iliac crests are symmetrical. Go ahead and bend forward. And no tenderness of the spine. Okay, no scoliosis, no lateral deviation. Come back up for me. And hyperextend. Good. And bend at your side. And the other side. And rotate around. And we're testing a range of motion of our spine. Curvature, as we would expect, we have concave cervical spine, convex thoracic, concave lumbar spine. We're going to take a look at your range of motion of your hips. So I want you to flex and extend and bring it up and internal rotate and external rotate. Okay, and circumduct and same thing. Flex, extend, internal rotate, external rotate, and circumduct. Okay, good. We're going to assess your gait. So walk a few steps that way for me. And it is tandem, and come back this way for me, heel to toe walking. We're just looking for balance, good balance. I'm going to have you close your eyes and just stand with your feet together. And we're looking for swaying. This is a Romberg test, minimal swaying, so we've got good balance and coordination there. Okay, if you'll have a seat for me. I believe this concludes our assessment. One more test. Tell me what word you hear. Hearing test, okay?
Monkey.
Apple.
Apple.
Okay. Hearing is intact. Okay. Do you have any questions for me? Any issues that are going on that we need to look further into today?
I think I'm good.
Okay. Have a great day.